Hi, I'm Bob Lederer, and welcome to Pharma Research Video Report, where pharmaceutical, healthcare, biotech, and medical device market researchers go for news, insights, and commentary about their field that they won't find anywhere else. Let's get started. Identity theft, a giant concern as well as a growing business, is morphing. It's got a healthcare counterpart. Medical identity theft grew 20% last year and affected over 1.8 million consumers. That according to VP Healthcare Fraud Solutions Christine Aravallo of ID Experts. And that company and its medical identity alert system known as Midas have been cited by Gartner as a cool vendor for healthcare payers. Midas is the first alert-driven software for healthcare payers, but its real value is in empowering members to monitor their own healthcare transactions, to take control of their medical identities, and to help fight healthcare fraud and medical identity theft. Midas sends text messages or emails, maybe both, to each alert plan member when a healthcare transaction is submitted for payment. Next, Australian researchers at Black Dog Institute and the Commonwealth Scientific and Industrial Research Organization made healthcare-related news using Twitter. They created We Feel, a Twitter tool that can map moods around the globe in real time, reportedly to improve the allocation of mental health resources. The researchers believe that We Feel can promote understanding of how emotions fluctuate over time from changes in social, economic, and environmental factors, things like the weather, the time of the day, bad news, etc. Generated We Feel data will replace population research that is over 5 years old in Australia, so said Black Dog Institute Director Professor Helen Christensen. And she added that if We Feel works the way it could, it will make possible monitoring the emotional state of individuals across different geographical areas and, quote, ultimately predict when and where potentially life-saving services are required, end of quote. Moving on, as 2014 progresses, there is growing interest about what is happening to healthcare costs here in the United States and what can be expected in 2015. Buck Consultants did a survey of 126 medical plan insurers and administrators and concluded that projected cost increases will actually drop between 0.1% and 0.5% this year. Some survey respondents point directly to reduced use of paid-for plans as the primary reasons for that drop, and that it is conjectured may be due to the economic slowdown and its dampening of consumers' willingness to actually spend for medical treatment. The insurers in Buck Consulting's report say there's been an average 9.2% jump in prescription drug costs this year, while pharmacy benefit managers report a weighted average trend factor of only plus 4.1%. To cap this week's report, research firm Research to Guidance is estimating there are more than 100,000 apps available on the iOS and Android app stores. More important to PRVR audience viewers, mobile health apps have accounted for, so far, $2.4 billion in total over the last few years. But by the end of 2017, those sales will explode to a total of $26 billion, about 13 times what's been spent so far. Research to Guidance's utilization analysis of Apple, Google, Windows, and BlackBerry apps shows 30.9% of them for fitness, 16.6% for medical reference, 15.5% for wellness. But the researcher foresees fitness apps becoming less important over time, its number one status plummeting to number 5 and shooting past it, remote monitoring and consultation apps. That's this week's Pharma Research Video Report. We are now available via mobile app for iPhone, iPad, and iPod Touch, and we're also downloadable from the cloud for those of you whose operations block YouTube. So there are many ways to view Pharma Research Video Report, and we hope you'll share it with your friends and peers in the business, and that we'll see you next week. Until then, have a good research week.